I'm Senator Saud Anwar. I'm the Senate co-chair. We are here to thank the committee for raising the bill 7275, House Bill, which is an act concerning tobacco regulations and enforcement. And we wanted to thank each and every one of the Finance, Revenue, and Bonding Committee members who are here and the ones who are listening. This bill is an important bill. We are here to show our support and thank you for raising this bill. There are some areas of opportunity in this bill. There is a loophole, and as a principle, I just wanted to make a quick little statement that would suggest what could be improved here. If anything contains nicotine, it should be taxed and it should be regulated. And we need to stay ahead of the loopholes. What happens in situations like this is that we know that there are non-tobacco nicotine products. And of course, in this case, we want to highlight Zen, which is being used, and it is fast growing usage amongst our children. About a quarter of the users are less than the age of 20, and that number is fastest growing, and the way the marketing is happening is through social media, specifically TikTok. And then that's where the number of children who are using this has increased. There is an increase at a rate that is going to follow the pattern of the vapes. And this is our opportunity as you're fixing this bill. We want to make sure that we are able to stop and close this loophole. And I wanted to yield to my esteemed co-chair to continue on with the same conversation. Thank you.
Thank you very much. Thank you to our chairs and rankings, and also thanks for raising this bill and for hearing this today. So as Senator Anwar said, we as public health co-chairs are asking to expand that definition and include the non-tobacco derived nicotine products. So why do we come here today as public health chairs? Because we know that evidence-based strategies work. And those evidence-based strategies that have worked for tobacco prevention, especially for youth members of our society, are smoke-free policies, that's the General Law Committee, price increases or taxes here in finance, and then health education campaigns, which is us in public health. We want to support the health and safety of all of our residents, and we too want to fund cessation, which is why we passed House Bill 6974, which has been referred to you, asking for the CDC's recommended $32 million. We know that that's a tough ask in this budgetary environment, and we're not here for that today. We know we need viable cessation strategies, and we need a plan to move away, as Senator Fonterra said earlier, from reliance on those tobacco revenues. That will take time. But at this point today, given what we know, we have ongoing concerns about the impact on young people and the initiation with nicotine products, including vapes and now nicotine pouches like Zyn. From 2019 to 2022, there was a 641% increase in the sale of pouches. Have that many adults used those pouches to quit smoking? We know that there is youth initiation. We also know that this product is not currently an FDA-approved cessation pathway, though I do understand that they are going through the process. The youth appeal, the promotion via social media, the engagement, the increase in youth usage, this is the same pattern that we saw with vapes, including the use of flavors. National survey data can often lag local reporting, and we know that there's a lot of anecdotal data out there now. We also know that the Surgeon General, the FDA, and others have found that nicotine's effects are not safe for youth and young adult brains. Ask the young people in your life. Ask your interns about Zyn and the usage of nicotine pouches. One high schooler shared with me that his friends are using nicotine pouches to quit vaping. I'm a mom and a social worker. I'm a long-term prevention volunteer in the community. I want us to use those evidence-based strategies and make sure that our youth reject nicotine in every form. So we're here today to, again, thank you for bringing this bill forward, to ask you to pass the bill and to add that language so that we see that strategy at work across the board. Thank you.
Thank you, and thank you for your, joint appearance on behalf of public health here today. It's important. At the risk of, I hope at the end of today we are inundated as a committee with data, because we have been asking for it all day long, and some people have already said that they've submitted it. But I believe, Senator Anwar, you made reference to some percentage of the users of the Zyn pouches, for example, are young people. Was that 20%?
25%.
25%. Okay. Because that, and I know you know this because you live in this world, but we have been, the industry has asserted to us that there's no evidence of youth uptake here. So it's very important to make sure that we see the data that indicates different information.
I would say that we are listening to the industry that has essentially at the beginning of new products and new delivery mechanisms of nicotine have always been on the wrong side of history. And after a few years, they say, well, oops, sorry, we were wrong. And they're wrong again. They're using new technology, TikTok and other social media, to try and recruit our children to get addicted to nicotine. Nicotine is the most addictive chemical that we know of. We know people who actually can give up literally any other substance, but they have difficulty giving up nicotine. It's interesting that when somebody is marketing this as a cessation tool, it's a switch. It's not cessation. What is happening is people are still using the nicotine. They remain dependent on nicotine. And we also see the pattern that the largest proportion of individuals who are using the product like Zyn are actually also smoking or using non-combustible vapes. They're using all the combinations in some of those cases. They remain addicted to the chemical. They're using changing the delivery mechanism. And the delivery mechanism keeps shifting between one or the other. And in many cases, we know that it's a way of getting somebody addicted to nicotine, and then subsequently they go to combustibles as well. The number of people who actually have used it for cessation are literally minuscule at this time from the literature. And it's not FDA approved. And for anybody to say that it's FDA approved should be another reason. Perhaps that should be in the Judiciary Committee to address these large corporations using technicalities to market their products to children.
Madam Chair, may I add to that answer?
Please.
You may recall in my testimony I shared that often national survey data will lag behind what that local reporting is. So this is a newer product. And so the data doesn't exist along the longevity lines that some of the other data that we have do. And what we've found in local prevention, and in Connecticut we have 169 local prevention councils, so every member has the ability to ask their community what they're seeing in their community. And sometimes that anecdotal data in terms of youth usage takes a little while to bubble up. The same thing happened, we saw the same pattern with Juul. And the former head of FDA is quoted in places as talking about what that looked like. So the percentage that Senator Anwar is talking about is the percentage of people who are using, which I think has been cited in some JAMA articles. We do know that some of the National Tobacco Survey data shows small numbers right now of young people who are using. But again, what we're seeing in the communities is that this is gaining traction, and it's particularly gaining traction among young men in our communities who I think are most at risk in this case.
And so before I violate my rule of 2 questions, I am looking to my right and left. There we go, Representative Veach. I'll come back with my other questions.
Thank you, Madam Chair. Good afternoon, both of you, for coming out to testify today. You know, I've heard a lot about these pouches and the push to get those in with this legislation. What about that gum that they used to have out there, the nicotine gum that is that a dead issue? Do they manufacture that anymore? I don't see it written down here. Do you have any statistics on that?
Sure. Here's what I would say. Thank you for that question. And if it contains nicotine, it should be regulated and it should be taxed. So by all means, but the nicotine gum is not marketed and it is not being spread the way the pouches are being used, and pouches are being strategically used to be the quote unquote the new vapes, the new way of trying to get our young boys and girls addicted. But the gum has been used in a different manner as a nicotine replacement, and it's recognized from that perspective. But it should still be regulated too. So
thank you for that, Senator. Lastly, can you tell me what the retail price point would be for these pouches that they sell?
I don't know the answer to that question, Representative, but if I may just add to Senator Anwar's answer earlier, I think the definition that we're asking to be included would not include a tax on FDA-approved cessation products. So the idea here is that we are asking those tobacco products that are not currently FDA-approved as cessation mechanisms to be taxed. But I do not know the price point at this point. I'm sure there are many others in the room who could helpfully answer that question. Happy to get that answer to you as well.
That would be great. Thank you both. Thank you, Madam Chair.
Thank you, Representative. Representative Farrar.
Thank you, Madam Chair. Thank you, chairs, for being with us. Appreciate your expertise. I did have a question really following up on hopefully just more of the understanding of the impact of on these pouches and nicotine in general on youth specifically. I think we often talk about, kind of the lifetime potentially of the addiction, but I was curious if there is anything else that we can learn, particularly around the medical consequences to youth in using nicotine at a young age.
Thank you, Representative, for the question, and I'll start and certainly defer to our medical provider as well. But again, there's not the kind of longevity of research. So we have seen some articles, again, that have referenced certain potential issues related to gums, and we don't know exactly. And I think I parallel this to the Juul process. So we're still learning more, but I think that's, again, what we do know, as I said in my testimony, that for young people, for the young adult brain, former surgeon generals, FDA, other medical providers have been very clear that nicotine is no good for those young people's brains.
I'll just add to this is that I divide them into three categories. One of them is neurologic changes. It does have significant impact on neurologic changes, and that's actually younger people are more susceptible, but even older individuals would be susceptible to changes in neurologic symptoms, irritation and headaches, and also lack of concentration capacity. There's emotional issues. The emotional issue relationship is quite significant as well, and we see that more in the young boys and girls, where there's a personality change. If you start to have conversation with a family with severe addiction, they would actually be not only having the irritabilities, but the concentration capacity, but the personality completely changes for individuals, and they are not able to, till they get the chemical or a substance, in this case nicotine, they would not be able to have a meaningful conversation and effect. And then the cardiac and risk factors, the risk of tachycardia or heart rate increase, the risk of blood pressure increasing is much more. American Heart Association is very clear on this issue. They have recognized that this causes heart attacks, this can cause strokes in the various age groups, older age groups more so, and what happens is that individuals who are using this, and if they are using more than one delivery mechanism, the risk goes up significantly. The long-term risk for heart problems increases much more because it not only causes the blood pressure to increase, the heart rate to increase, it makes the blood thick. And then it's like a worst case scenario for individuals. It changes, and thankfully when a person stops, it changes that because the lifespan of that product is short, and that can change things in a matter of a few hours. But thank you for this very important question.
Thank you both. I appreciate it. I think on this committee, we're often thinking through, what type of behavior we're incentivizing or disincentivizing with taxes. So I appreciate you just giving a greater vision to what this actually means for youth that are picking up this as an addictive habit. So thank you.
Can I make one quick comment to your point?
Yes.
When we look at the studies for combustible cigarettes, one of the most effective impact of cessation in the history of tobacco cigarettes, the combustible one, was taxation increase. And that's something that is used as an example of using the taxation model for changing behavior. That taxes have actually not only helped the states to be able to look at cessation effect, but the cessation itself has led to safety of so many lives that would have been lost otherwise. Thank you for raising that question too. Thank you.
Thank you, Senator. Thank you, Madam Chair.
Thank you, Representative. Senator Cabrera.
Thank you, Madam Chair. Thank you both for being here. So good to see you. First, thank you for your leadership on this very important issue. I'm having flashbacks of the large tobacco settlement when I was a kid in the 80s, where I think the country realized that they had a problem and they needed to do something about it. And I know that you talked a little bit about the different delivery ways in which nicotine is being delivered. It just seems like every other day there's a new mechanism by which to deliver nicotine to your young people. And I was hoping if you could speak a little bit about your personal career, especially as a social worker and as a doctor, what you're seeing, what the patients and clients you see, especially young people. Also, if you've seen an uptick since COVID. I know our young people are dealing with lots of mental health issues. Are you seeing more and more children gravitate towards these products to deal with those issues?
Senator, thank you for the question. As I mentioned, I've had the privilege of working with Fairfield Cares Community Coalition for over a decade, which is our Fairfield Local Prevention Council, and have worked with others regionally. You may be interested to know that every community in the state through the Department of Mental Health and Addiction Services does receive a grant to focus on tobacco prevention. So we, again, know that what those promising practices and evidence-based practices are the smoke-free policies, pricing, and health education campaigns, which is what those DMIS dollars are directed towards. So depending on the efforts and ability of the community to implement that, there have been, I think, some impacts in those investments, but we've seen the shift over time. We've clearly seen and know from the data that the use of combustible cigarettes among young people has declined precipitously. Vaping has gone up. So I would, and then now we have new products, as you said, as we were talking about today, which is why I know we're focused today in the additional language, but the bill before you itself is actually also very important in terms of making sure that we're looking at the full range of products and how we make sure that we cover those. But it's still an ongoing issue and problem because our young people, as they're forming their identities, as they're working through mental health issues or just their typical development in terms of experimentation and trying to fit in, the more access they have to different products, the more opportunity that they will have to try it. So again, I will use this opportunity to say we certainly want to make sure that we're using our settlement dollars to be able to invest our trust fund work that's done here. We're funding the quit line and making sure that we're putting money towards those other cessation efforts is really important for our young people and adults too, of course.
Thank you, Senator Cabrera. Thank you for your question. I'm a pulmonologist. I see this every day, and it's painful to see this situation every day where the largest number, and I take care of adults primarily, so this morning I started seeing 10 patients that I saw this morning, and 5 of them had combustible cigarette-related disease. Our lifespan has decreased as a state, as a country, because of tobacco use. And now what's happened is that you have these companies who knowingly marketed this. And that's why there has been these lawsuits which have resulted in the effect. And they knew that this was an addictive chemical, and knowingly that it causes cancers and other illnesses and emphysema and COPD, they continue to market this. And then that has caused more deaths than any other disaster collectively. And that's the sad part for the United States. Now, we have seen the same chemical, nicotine, being used to get the next generation lifelong use of this chemical. And we saw that in vapes, how rapidly that spread. And this was like doubling up every year, that the number of young boys and girls in middle school and high school were increasing the using this. And now the delivery mechanism is being changed, but the chemical is the same, the addiction is the same. Perhaps they will argue that the combustible is worse than the vapes, and the pouch is less dangerous than the combustible. You can make that argument, but the nicotine addiction is the enemy at the end of the day. And that's why this bill that you have so important bill that you have raised is such a critical part of our opportunity to make sure that we actually have parity on nicotine, tax all nicotine. And then that's going to be important, unless it's going to be used, as was stated earlier, for a cessation purpose approved by the FDA with the guidance of clinicians in those cases. Thank you for your question.
Yeah, I appreciate the answer, and I really appreciate both of your leadership on this. You know, I'm dating myself a little bit, but I just think of the world our young people have to navigate. As a father of two young boys, I struggle with just finding time to be with them, and more and more kids spending time online, being susceptible to social media, spending large amounts of time online, and being susceptible to these messages. I think it's appropriate that we look at this thing holistically. The reality is our children are growing up in a world that is extremely different from the one we grew up in, and especially young minds who are susceptible to all kinds of messages. So thank you both for coming here, and thank you both for your leadership on this. Thank you, Madam Chair.
Thank you, Senator. I will recognize myself for the second time, seeing no other hands up at the moment. Two arguments that I have heard that I just want to give you a chance to address. One is with respect to the nicotine pouches. I think I'm at least becoming familiar with them for the first time now, so they seem new to me. I've had the industry tell me these have been around for 10 years. And if there's no data to suggest that they're inducing young people to use them and become addicted, that's because they're not. I wonder whether you could address that.
Thank you, Madam Chair. And I would say to the good senator's comments, the world has changed significantly from a social media standpoint in the past 10 years. So I learned this week about something called Zinfluencers, which are social media influencers related to Zyn. And, forgive me, there are other pouches, and I don't mean to single out Zyn. There are other pouches. But I think what's important, I was at the Alcohol and Drug Policy Council meeting yesterday, and we were looking at different marketing of different cannabis products, and the way that marketing is used to specifically direct young people there. And now, again, I'm not suggesting that this is all necessarily a company. I think there is a culture that can surround a product, and sometimes things will just happen to evolve on their own. And I do think that that's a little bit what has happened in this case. Again, there's a lot more data that we still need to gather and learn. But part of the issue is, once you initiate use as a young person, and one of our indicators when we look at grants for substance use prevention, we look at age of onset. So the longer we can go before someone, say, tries any nicotine product, the less likely they become addicted for a lifetime. So when we think about TikTok and the fact that so many young people are spending so much of their time there, and the things that they're seeing, whether they're necessarily specifically targeted or not, they're there, they're out there in the ether. And I think that's, again, the anecdotal evidence that we're hearing in the community. When every young person who I've asked about this over the past couple weeks has, kind of laughed, oh yeah. So that's part of the struggle, is because we don't have all the data that you are looking for yet in terms of young people. Again, I come at this primarily from that youth prevention perspective, but well aware that the majority, so many of the people who are adult smokers who want to quit, and I heard Senator Pompera's remarks earlier and learned that he and I are fellow have sugar habits, I will say. But I agree with what he said. We have to be thinking about how to help support those who want to stop. I'm here having this conversation because my grandfather died from smoking when I was 15. That's why I got into this whole work in the first place. I don't ever want to see anyone suffer and struggle the way that he did, which is why prevention. But that's a long way of saying I think the culture around this has changed and shifted and has had a significant impact.
So could I just follow up on that? And I think Senator Anwar has addressed this a little bit, but just squarely, the argument that my co-chair made earlier, which is that given the catastrophic health issue that is tobacco, both smoked and chewed, that if nicotine, the addiction of nicotine is if you can separate the two, and if somebody can use a nicotine product to stop the catastrophic use of tobacco, why aren't the health effects of nicotine sort of just a side effect of medication like we hear about other things?
So it's a fair question, but you have to look at this is that before this gets approved as a cessation tool, you have to go through a process, and the cessation tools that are much more regulated. They have to be watched very carefully, have been done studies in a manner where this can be effective. How can, and I'm going to use the name of a company, how can Philip Morris have their TikTok Zin account have 700 million young boys and girls see that and claim that this is going to be a cessation tool? This is a marketing strategy to get our young boys and girls addicted. That's what it is. They can package it the way they want to. Their history does not suggest that they'll do the right thing. I'm sorry to say. Having said that, if it becomes a FDA approved tool under rightful guidance with prescription authority, we would be back here saying that this is how it should be. But until then, this is harming our children, and this should be stopped.
Thank you.
Thank you.
Representative Zapkus.
Thank you, Madam Chair. Hello. I'm used to seeing you in public health, but thank you for coming today. And I guess mine is more of a comment because, you know, we do need the data on this. And I heard you, Representative, talking a lot about data, and we need data on everything. So I just wanted to make sure that we are in agreement on that. And I think, but the data shows us a lot of things and what we need to work on and where our weaknesses are and where the strengths are in all of this. My second comment was about marijuana, and you mentioned that also. And I've been told, I don't know, I too don't want my kids vaping. You know, we talk about it all the time. And I've been told you can get, I guess it's pot oil. I don't even know what to call it, like in vapor packages. So I think that also needs to be looked at in this because it's part of it, right? So if we're talking about vaping in general, I think we need to bring that into the fold also. And just was curious, what are your thoughts on that?
I will start. Thank you. It's very nice to see you here, and Finance Representative too. My commentary today has been focused on this in part because of the settlement agreement and the way the definitions are, and because it is so specifically tobacco focused. But as I mentioned, you know, serving on the Alcohol and Drug Policy Council as the co-chairs of Public Health, I think there are certainly conversations that are happening and need to continue happening when it comes to cannabis. And again, I'll use this as an opportunity to point out, if you watch that Alcohol and Drug Policy Council meeting, you can see the difference between what we regulate here in the state and the type of labeling that is allowed for where cannabis is sold legally in Connecticut versus what is not legally being sold, and the difference in the packaging and the marketing. And I think, you know, that's, again, one of the reasons why we're here today is to make sure that we're looking at all of these. But specifically, I think in working with the Attorney General's office, they can probably speak a little bit more to the specifics of the settlement and the definitions here to support that, but happy to talk more about those other issues as well.
I'll just make a few comments. Thank you, Representative Zapkus, for your question. And this is an important issue. It's a little bit outside of the realm of the bill, but I think it's worthy from a public service announcement to say a few things, and I'll just use this opportunity to do that. It's no secret I voted against the cannabis bill, and there are a number of issues that we have to recognize. Anybody?
I didn't know that. I'm glad you did.
Yes, thank you. Anybody less than the age of 18 who uses cannabis, their part of their brain growth is impacted for a long, long time. The other component is that any combustible delivery mechanism is associated with oral cancers and lung cancers. And also, we know that in younger individuals, less than the age of 25, the risk of addiction is much higher. We also know that if anybody's operating machinery, including cars, When they have cannabis in their system and they have alcohol, the combination will make them unsafe to be able to operate. That data is available to some degree in other states that have done this for much longer, but it's a recognized issue. And also, it's well recognized that individuals who use cannabis, there's a subsegment who are going to develop a condition called psychosis, where this can be reversible, but it has to stop. And also, hyperemesis is a big issue that we know that if a person starts to vomit and have excessive vomiting, get dehydrated. So there are issues. That's why there needs to be a reassessment on the dosage, mechanisms of delivery, and reassessment from a public health lens to see how this could be improved going further. So thank you for the opportunity to share some public health perspectives.
Well, thank you, because I understand this is tobacco, but it's vaped. It's all the same, like you talked about lung cancer, whether you're smoking nicotine or you're smoking pot. I can't see any difference that it wouldn't affect your lungs. So to me, it's kind of all in the same package, even though it might not be in this bill, but I appreciate it. I really wanted to know your thoughts on that. Thank you.
Madam, may I respond?
Please.
And say thank you. I think it's been one of the challenges for us as public health chairs. As I mentioned earlier, some of those evidence-based strategies and the way we do our committee work, some of that work is in general law, some of it is in public health, some of it's here and elsewhere, actually, honestly. But I think one of the challenges we have with the tobacco language is the master settlement agreement, which was specifically with respect to tobacco. So that's, I think, a big driver of this piece of the conversation and sometimes limits us. I think that's the beauty of this bill, actually, is, to your point, it does broaden, perhaps not as much as you were hoping, but it does broaden and expand, so we're catching more. But your point's well taken.
Thank you, and I do agree that there's a lot of crossover in all the committees. So anyway, thank you, I appreciate it. Thank you, Madam Chair.
Thank you, Representative. Representative Constantine.
Thank you, Madam Chair. Thank you so much for your testimony. Rep. Vahey, you didn't know what zinnies were until this week. I didn't know what Zin pouches were until you guys both sat here. Thank you so much for your testimony and, telling us why you think it should be expanded to all nicotine. So I guess I had two questions. One, listen, Zin had $1.8 billion in sales last year. So if you're telling me that 25% of users are under 20, that sounds like, my number might be clarified, but that's what it shows online. But it sounds like our youth are, heavily using this product. Can you talk, because the pouches go directly from the mouth into the bloodstream, that's how they're absorbed. Dr. Senator Saud Anwar, could you talk about the health benefits of that, the health costs? And then I was just wondering if we included all nicotine in this bill, what you think should be done with these funds, if it goes specifically into these funds, or what you would want to do, because earlier we also did hear one of the, I believe Senator Fanfara said, about education for cessation efforts. So I'd like to know your thoughts on that. Thank you.
Thank you for a very good question. So I think the absorption is pretty rapid. What happens is that even for the gum and also for the pouches, the nicotine levels go up. The person who actually is consuming them feels that their nicotine desires have been fulfilled very rapidly because the absorption is so fast. And that's part of the addiction as well. So when people have patches which are used, they grow on the nicotine level goes up very slowly over time. So people do not feel the actual fulfillment of their needs for the nicotine addiction. So this is more likely to be addictive than the slow gradual increase in the nicotine levels. The nicotine addiction is a long-term issue, and also the delivery mechanism has long-term issues. So whenever somebody's using the pouches, there's going to be oral cavity related diseases that are much more common in those individuals. For the vape products, there's actually lungs are much more involved in those, and their long-term impact, including immediate effect on the airway reactivity that goes up. And the tobacco, of course, the risk for lung cancer and others are much higher in those things. The use of the tax money, the first thing is I would not use it to bring the utility costs down. But I would start to use it from a public. I'll have to put that in there. But I think it would be used for public health and also treating the illness. It should be very focused on trying to reduce the addiction and looking at the entire combustible, non-combustible, all forms of non-tobacco nicotine addiction as one group of challenges to be addressed. And we need that money to be able to address that, and it would be very effective use. We have already shown it's effective with the 12 million or so dollars that we have in the last few years, every year allocating for that. Madam Coach.
And I'll just add again another commercial that the CDC recommends 32 million a year as a minimum number for us to be spending on those efforts. And we are grateful for the funds. I certainly would echo, I would love those tax revenues to be used directly for prevention, intervention, treatment, cessation. But I recognize we are the public health chairs and you are the finance committee who has to put these pieces together. But ideally, we would get to the point where we were fully allocating that minimum recommended CDC amount for those, again, those evidence-based strategies for, you know, enforcing as well as educating and making sure that we're preventing.
Any for Representative Mashinsky?
Yep, I just wanted to ask public health chairs. We did have this discussion earlier today about some folks on the committee think that you need the flavored vapes to quit smoking, and then others of us are worried about youth smoking, or youth, youth vaping. How do we address both those issues? How do we take care of the people who are adults who want to quit without enticing new nicotine users through the use of flavors?
Thank you for that question, Representative Mashinsky. And as I mentioned earlier, it's absolutely critical that we provide support to those adult smokers who want to quit. And I say here, Senator Fonfara said before you were in the room that I share that sugar predilection. I might say addiction on my part, but that I can only imagine what a nicotine addiction must be like and how difficult that is. And we do know, and we have evidence that so many adult smokers do wish to quit. So what we should be doing is properly funding those ways that we know that are effective and approved in terms of things like funding the quit line, the things that our trust fund group that's now back up and running is doing. And we need to balance those needs. I think, as we mentioned earlier in testimony, this expanded definition would exclude FDA-approved cessation efforts. So in the event that this mechanism of nicotine pouches were to be approved, that would then not be part of the taxation effort. But I will also say something I haven't said before. You know, we're a capitalist country, and there's nothing wrong with the business, you know, of for-profit business models, right? There are only so many adult smokers, but there's an ongoing pool of young people ready to be enticed and initiated into a nicotine addiction. And just from a financial modeling standpoint, there's, you know, motivation there just financially to continue and have ongoing access to that financial support in that market. So I am acknowledging that, yes, we have to continue to provide support, but we need to think also about the long term with our young people as well.
I can attempt to answer a little bit and add a few things. So I'll just start with the fact that many people believe that corporations are people, but if a corporation has been responsible for killing millions of people, they should be treated like an individual who has treated millions of people, and then go through that process as well. With respect to the nicotine addiction, and I would just have that divided into different categories. There's a physical addiction, there's a chemical component that's part of it, and then there's also a social addiction and emotional addiction to it. For the physical addiction, there's a replacement option. The replacement option is not the only way to go about it, but the replacement options are various ones for delivery of nicotine. That has to be well regulated and controlled, because in the wrong dosage, it can cause heart problems and other complications for individuals who continue to use more than one delivery mechanism. So it should be done not randomly, so that the person can go to a store and buy all different combination of things, and then the companies that are marketing them create a perception that everybody's using it for cessation perspective. So that loophole is being exploited very effectively by the companies, and the same companies essentially, who have used this for that purpose. And we know the results of that, because there's a way to track this, and that tracking has told us that this is not healthy for the next generation of children. More so adults are the ones who are already in the addiction. We need to actually stop that pipeline. There's an on-ramp, there's an off-ramp. The on-ramp needs to be blocked. The off-ramp can be streamlined, and that's why it can be done with the existing clinical resources in place. Thank you for that very valid question, important question, Representative.